Hi everyone, my name is Dr Brooke Vandermolen and I am an obstetrics and gynaecology doctor and Yoppie's in-house women's health expert. Your periods may be something that you are highly aware of, or it might be something that you pay very little attention to until the time that you're actually trying to conceive, when you really need them. Many of us experience periods all our life, but because we don't talk about them, it can be difficult to know what is normal and what is not normal. So before we get started, if you aren't doing it already, I really recommend that you spend a few months closely tracking your cycle. Use an app to log all of the symptoms that you get throughout the months, like when you get bleeding, discharge, PMS and more, and that way you know what is normal for your body. If you're already familiar with your monthly cycle, here are 5 simple things to look out for to know if your cycle is healthy or if it needs you to check in with your doctor. First up, cycle length. So let's think about the length of your cycle. We measure this from the first day of your period to the first day of your next period. The average menstrual cycle is around 28 days long, but it is normal for a cycle to vary by a few days each month. It is also useful to track how long the bleeding lasts for. Irregular periods are when the length of your cycle, so the day between the first day of your bleeding to the first day of your next bleeding, varies from month to month. So your periods may come early or they may come late. You don't need to get medical advice if you've always had irregular periods or if you're still going through puberty. However, here are some signs that your cycle may not be completely normal. First up, your cycle lies outside of the range of 21 to 35 days. Your periods may last longer than 7 days, or if there is a big difference, so at least 20 days, between your shortest and your longest menstrual cycle. If you have irregular periods and you're struggling to get pregnant and it's been more than 6 months of trying to conceive, or if your periods become suddenly irregular and you're under the age of 45. There might not be anything wrong, but it is a good idea to get checked out to see what the cause could be. Flow. So let's think about how much blood is normal to lose in your period. Most women lose around 80 mils, but who knows what that looks like anyway. What seems heavy for one woman may feel completely normal for another. So therefore, to help you to work out if your bleeding is generally considered abnormal or heavy, see if it fits with any of these issues. So first up, having to change your sanitary products every 1 to 2 hours. If you're passing blood clots larger than about 2.5 centimetres, which is around the size of a 10p piece. If you're bleeding or flooding through your clothes or your bedding. If you need to double up on your sanitary products, so you're having to wear tampons and pads at the same time. For about half of women, there is no underlying cause to explain why their period is so heavy. However, if you think your period is excessively heavy for you, then seeing your own doctor could help to decide if further testing would be useful to identify if there is any underlying cause or if there is any treatment that may be of benefit. Your cramps. So the pain associated with your period is known as dysmenorrhea. It may be normal or abnormal depending on the severity and the cause. Most women do have some mild pain or discomfort during their menstrual cycle. It's an unfortunate side effect of having a regular period. However, we're always told from a young age that it is normal to have painful periods. They're just part of being a woman. However, as gynecologists, we often see the effects if women put up with this for far too long. It's important that if you aren't sure if your symptoms are normal, then you see your GP. There's 2 types of painful periods. It could be primary or secondary. Primary has no clear gynecological problem underlying it. It's the effect of the hormones that are released during menstruation, which stimulate uterine contractions and pain. Secondary is when there is an underlying cause. So there can be a diagnosis such as endometriosis or pelvic inflammatory disease that is resulting in these heavy, painful periods. If you have painful periods and you're not sure if it's normal, these features may suggest that there is an underlying cause associated with it. So if the pelvic pain is not just confined to during your period, but it is typically worse during menstruation. If your periods were previously painless but are now painful. If you have other symptoms such as pain during sex or you're having difficulty conceiving. The next symptom to check in with is your discharge. At different times in your cycle, your cervical fluid can change to make it either more difficult or more easy for sperm to swim past into the uterus. Cervical fluid also protects the sperm from the acidic environment of the vagina, and it contains antibodies which can keep out unhealthy bacteria and viruses. If you want to get to know your cervical fluid, you can use your fingers to feel for the fluid at the entryway to your vagina, or you could take a look on the toilet paper when you wipe. Look for the colour and the consistency of the fluid. Feel for things like thickness, wetness, slipperiness or stretchiness of the fluid. Document these changes in an app throughout your cycle, and it can help you to identify when or if you are ovulating. After your period, it is likely that your cervical fluid will be quite dry with very little fluid present. As you lead up to ovulation, you'll notice it becomes more creamy or white, and it has a consistency like a lotion as your estrogen levels rise. Around the time of ovulation, the discharge will become more like the whites of an egg. It will feel stretchy, clear in colour, and slippery. This indicates that ovulation is about to take place, as estrogen levels peak 1 to 2 days before the egg is released. After ovulation, the discharge becomes more sticky or dry and lasts until menstruation occurs. Finally, the other symptoms to look out for. So there are some indicators that can give you an idea that maybe your cycle isn't completely normal, and it gives you a heads up that you should seek medical advice. Firstly, while PMS is common, if you experience an extreme form of PMS that makes it difficult to work or to have relationships, this may need specialist input. Bleeding should only take place during your period. So if you find yourself bleeding at other times in the month or after sex, then again, it is worth getting checked out. Finally, remember to watch out for other symptoms during your cycle, like things like painful sex, unusual coloured or smelling discharge, or pain at other times of the month, so not just when you're having your period. If you aren't sure if any of the symptoms you experience are normal, do get checked out. So we really hope that this helps you to understand your cycle better. Don't forget to subscribe to our channel and check out www.yoppie.com for more videos like this, and also for personalised period care subscriptions that can help you manage your cycle. We've got lots more articles around your menstrual well-being.